Now I recognize Ranking Member Mervan for his opening remarks.
Thank you, Chair Kiggins. I am pleased that the subcommittee is considering several pieces of key legislation that will take steps towards ensuring that the VA workforce is supported and has the tools they need to provide world-class care to our veterans. Today we are considering H.R. 6538, the VA Correct Compensation Act of 2023, a bill championed by Ranking Member and full committee Congressman Takano. I am proud to co-sponsor this important piece of bipartisan legislation. This bill protects Title 38 VA employees' right to collectively bargain over issues with their pay. For instance, currently, if a Title 38 VA nurse works overtime and that overtime is not reflected on their pay stub, the VA can limit that nurse's ability to grieve that error through the bargaining unit. The VA Correct Compensation Act is a critical tool to help with employee retention, so employees know they have the path to be made whole when there is an issue with their compensation. For years, we have been hearing from Title 38 nurses and other critical medical center staff about how they are denied the collective bargaining rights that their federal healthcare worker counterparts are afforded under the law. Last Congress, we came together to pass the VA Employees Fairness Act out of the House of Representatives. That bill addresses the limits the Secretary's authority to deny collective bargaining and grievances right for Title 38 VA medical professionals, including the employees who care for our veterans every day, like RNs and CRNAs, physicians and physician assistants, dentists, and more. Currently, these frontline employees are prevented from raising grievances about issues such as professional training and patient safety policies that undermine patient care. There are still substantive policy disagreements among members of Congress as to fixing this issue, but I look forward to working with Ranking Member Takano to reintroduce the VA Employee Fairness Act soon and restore full collective bargaining rights for the VA Title 38 healthcare professionals. In the meantime, the VA Correct Compensation Act is an opportunity to make a bipartisan, meaningful impact on union rights for VA medical professionals in the near term. What the VA Correct Compensation Act does is simple, but incredibly important. This bill ensures there is a fair process Title 38 VA employees can access to make them whole when there is an error in their pay. I appreciate the work done thus far from our union partners on this bill, as well as the support of the VSOs. This bill is endorsed by the Service Employees International Union, National Federation of Federal Employees, the American Federation of State, County, and Municipal Employees, the American Association of Nurse, and the Senior Executive Association. I would like to specifically thank the American Federation of Government Employees, or the AFGE, for their support and continued partnership with our committee to bring us issues and solutions to those issues the VA employees face. I would like to extend a warm welcome to Ms. Joycelyn Westbrooks, who is representing the AFGE today. Ms. Westbrooks has served as a registered nurse for the VA for 40 years. Thank you for caring for our veterans. Thank you for advocating for your fellow VA staff, and thank you for being here. Throughout the AFGE's testimony, we will hear that unfortunately, errors in employee pay at the VA is a common problem and one that has affected far too many of their dedicated health professionals. In many instances, VA has miscalculated or failed to pay staff for overtime, holiday work, or weekend shifts. In some cases, it has taken months for VA to get those employees the pay they have earned and have rightly owed. It is easy to imagine how errors in pay can affect an employee's livelihood and their morale. The VA Correct Compensation Act rectifies this inequity, and I hope to see it advance through this committee as soon as possible.
Ms. Westbrooks, you are now recognized for 5 minutes to provide your testimony.
Mervan and members of the subcommittee, thank you for inviting AFGE to today's hearing. My name is Joycelyn Westbrooks, and I'm the Secretary-Treasurer for AFGE Local 1633 at the Michael E. DeBakey VA Medical Center in Houston, Texas. For the past 40 years, I have had the honor of serving our nation's veterans as a registered nurse at the VA, the nation's best healthcare system. On behalf of AFGE and its National VA Council, representing over 300,000 VA employees, including 75,000 Title 38 employees, I am here today to strongly endorse H.R. 6538. the VA Correct Compensation Act, or VACA. This bipartisan bill is also endorsed by our sister unions, NEFI, SEIU, and AFSCME, as well as the nurse anesthetists and our VSO partners, DAV, PBA, and the American Legion. The legislation will limit the agency's power to deny grievances challenging routine payroll errors affecting Title 38 clinicians. Since the enactment of 7422 in 1991, the VA has used its authority to deny grievances related to the establishment, determination, or adjustment of employee compensation. For years, this committee has examined ways to amend 7422, including the VA Employee Fairness Act. I raised this bill because through spirited debate, a consensus emerged that the VA has misused its authority under 7422 to routinely not pay payroll errors. Chairman Bost and Ranking Member Takano have built on that common ground and crafted a bill that we can enact this Congress. The fruit of that labor is VACA, a technical correction to the 7422 statute that defines the compensation exception in 7422 and explicitly prevents the VA from denying grievances contesting that a covered employee has received the correct compensation as required by law, rule, regulation, or binding agreement. This common sense bill will allow employees to file a grievance and have a fair process to make themselves whole. Unfortunately, payroll errors are a common problem at the VA. Too often, the VA fails to accurately calculate if a covered employee worked overtime, the night shift, weekend shift, or holiday. If the affected employee is a Title 38 hybrid, that employee could easily file a grievance and receive the money they are owed under the law. However, if an employee is a pure Title 38 employee, the VA threatens and does invoke 7422 to deny the grievance, with the employee losing the ability to receive the compensation they are rightfully owed. In practice, that means that an RN does not have the same rights as an LPN, an optometrist does not have the same rights as an audiologist, and a psychiatrist does not have the same rights as a psychologist. Beyond this inequality, over 30 years, the VA's use of this authority has discouraged employees from even filing grievances to correct their pay, and that harms retention. A clear example of this arises from the Asheville, North Carolina VA, where the AFG filed a grievance on behalf of the nurses, claiming the VA failed to pay the nurses' night differential and weekend pay. An arbitrator ruled in favor of AFG, but the VA refused to pay, citing 7422. The Undersecretary for Health reaffirmed its use of 7422, denying the grievance. In 2007, the VA failed to accurately pay for overtime in Buffalo, New York. The VA chose nurse practitioners to work 8 Saturdays to address a backlog. That year, UAN and NNU filed a grievance alleging that management owed the employees Saturday premium pay in addition to the overtime pay. The VA invoked 7422, denying the grievances. Beyond these examples, I want to share that why this bill hits home for me. My dad was a decorated Army veteran. He passed away at 52 from cancer. My family and I forever appreciate the VA for the instrumental part it played in his final days. When my dad needed more intensive care than could be provided locally, the VA airlifted him to a regional hospital to receive that care. Those nurses and doctors who cared for him are our sheroes and heroes. Title 38 staff in VA hospitals across America are answering the call for so many families and meeting the demands and needs of our veterans. We have a basic responsibility to correctly compensate these providers as we do other staff. Congress never intended for 7422 to permit the VA to deny grievances over routine payroll errors and unlawfully without the compensation due to its employees. When I grew up, you pay people what they're owed for an honest day's work. This is not Democratic or Republican, but American, and not complicated, but common sense. By passing the VA Correct Compensation Act, Congress can prevent problems and force the VA to pay Title 38 clinicians what they're owed under law. Thank you, and I'm happy to answer any questions.
Ms. Westbrooks, thank you again for being here today and for your tireless commitment to caring for our nation's veterans as the VA nurse. In recent Congresses, this committee has taken up pieces of legislation that would ensure key bargaining rights to the Title 38 VA medical staff. Some members of this committee have argued that providing these rights would affect patient care. However, I'm glad that many of us on both sides of the aisle agree that the VA medical professionals deserve the pay that they have earned. Can you describe the impact the VA Correct Compensation Act will have on the VA's ability to recruit and retain the best workforce to care for our nation's veterans? And does this issue matter to your membership?
Thank you, Ranking Member, for that question. Mervan, thank you so much. Yes, actually, this is very important to our clinicians, our Title 38 at our VAs. I understand what you're saying about another process, but we're asking that the process be the process that's already in place for the hybrid Title 38s. I have nurses that on board, physicians, physician assistants that on board with the wrong salaries, with they don't get their, for nurses, they don't get their differentials, their holiday pay, their weekend pay, and presently, they don't have the ability to grieve these instances as the hybrid Title 38s. And unfortunately, some will stay. We try to work with the agency to work through them. But the process can be sometimes a year or 2 years getting settled. And because nurses, doctors, physician assistants, chiropractors, podiatrists, they have many, many choices. A lot of times they will not stay. And this is what I say. I've been with the VA a long time, and I believe in its mission. But if we say that we want to take care of America's heroes, then we have to retain the best and the brightest. You will never pay them what they're worth. There is no salary. But they should be paid what they are due. They should be paid what we say that we owe them. And they should not have to fight about it. I understand about doing things expeditiously, but that doesn't happen, unfortunately. And so we lose wonderful staff because of it. And I've seen it over these 40 years, time and time again.
Thank you, Ms. Westbrooks. With that, I yield